Mr. Long. Okay, Jonah, this is patient assessment medical. You have 15 minutes to complete. You're dispatched to a 56-year-old female complaining of really bad gastric reflux.
Okay. Be advised my scene safe.
Yes.
All right. Is this my only patient?
Yes.
Okay. My NOI right now is just some GERD, gastric reflux issues. I'm going to also always call in additional resources if I need them, and then consider C-spine if necessary.
Okay. You arrive on scene. You find her in her house. She's sitting on the couch clutching her chest. She says that her GERD's really bad today. She has a history of GERD.
Okay.
And it just hit her all of a sudden.
Okay.
Never like this before.
Okay. What's my general impression other than that? Just pale?
She's a little pale.
A little pale? Okay. Well, that's my general impression of my patient so far. Any apparent life-threatening injuries?
Nope.
Okay. Chief complaint is that chest pain from GERD, those kinds of issues. Level of consciousness, is she responsive to?
She's alert.
Alert, okay. ANO times 4, all that stuff. Perfect. I'm gonna check her airway. Is her airway patent?
Yes.
Okay. Breathing, rate, rhythm, quality.
She is 20 a minute, regular, bilateral chest rise and fall.
Okay. Circulation, rate,
She's
rhythm.
pale.
Pale. Okay. My pulse.
Regular.
Regular.
Her cap refill is delayed.
Delayed. Okay. Over 2. Okay. My transport decision is just due to her skin signs and just slower perfusion. I'm gonna just start getting her headed towards the ambulance and get that started.
Okay.
I'm gonna go into some of my history taking as well. When did this start?
10 minutes ago, she was out in the garden.
Okay. Is there anything that makes it better or worse?
Nothing has made it better.
Okay.
She took some Tums, see if that would help. They didn't.
Okay. What kind of pain is it? Can she describe the pain?
She's like, it feels really like somebody's sitting on my chest or something.
Okay. On like a scale of 1 to 10, how bad is it? 10 being the worst, 1 being
10.
the least. Is it 10?
I've never felt any pain like this before in my life.
And then it started approximately 10 minutes ago?
Yes.
Okay. Those are my signs and symptoms. Started about 10 minutes ago. Feels like someone's sitting on her chest. 10 out of 10 chest pain right now. Any allergies to medications?
She's not allergic to any medicine.
And just Tums for medications, or are there any others?
She takes a GERD med, doesn't remember the name.
Okay. Does she have history of cardiac injuries or illnesses?
No.
No. Never been diagnosed with angina or anything like that?
Never.
Okay. When was her last oral intake?
She had breakfast.
Okay. Any special events leading up to this?
No, she was just out in the garden. Then the chest pain started.
Okay. All right. Well, I'm going to also ask any additional clarifying questions I might need. I'm going to also just double check any of my other secondary systems as well. Cardio, pulmonary, GI, GU, neurological, spine, or any sort of cervical issues, any of that kind of stuff. I'm also going to get a set of vital signs going as well. I want a blood pressure, pulse, respirations, my quality of respirations, SpO2, BGL, and I also want to get a 12 lead going as well.
Okay, pulse is 110 and regular.
Okay.
Blood pressure is 160 over 100. Respiratory rate's still at 18.
Okay.
She's alert. Respiratory quality is good. Pulse oximeter is 90% room air.
Okay.
Blood glucose is 100.
Okay.
12 lead comes back. You have elevation in T3 ABF.
Okay.
Depression in V1, V2.
Do I have any reciprocal changes in my lateral leads? at all?
Yeah, 5 and 6.
Okay. All right. For
What
this,
STEMI is that?
that is going to be an inferior wall STEMI. This does meet STEMI criteria, so I'm going to get my patient immediately going to the hospital. I'm going to also make sure I'm reassessing those vitals, printing off a 12 lead every 5 minutes. I'm also going to start with 0.4 milligrams of nitro for my patient as well.
Okay.
I'm going to do 324 milligrams of aspirin. I'm going to also take into consideration any sort of oxygen therapy I might need.
Okay, she's 90% at room air.
Okay, yep. I'm going to put my patient on, right now, just 4 liters of O2 or via nasal cannula.
Okay.
And then also I'm going to administer morphine as well through large bore IV that one of my partners has done.
Okay. How much morphine do you need?
0.1 milligrams per kilogram.
All right.
Now I'm going to reassess my interventions as well. Do I see any changes in my interventions?
No. Patient does report that her pain has gone down. From
Okay.
10 out of 10. She's 6 out of 10.
6 out of 10 right now. Okay. I'm going to reassess my vital signs as well every 5 minutes.
Blood pressure is now 140 over 90.
Okay. All right. What's like my pulse now? Is it still
115.
okay? Has my O2 saturation increased?
Yep, she's 94%
Okay.
on your 4.
Okay. Perfect. And then my respirations are still normal.
Mm-hmm.
Am I seeing any increased elevation in my 12 lead or any changes in my 12 lead?
Nope.
Okay. Perfect. Well, I'm going to take her to my nearest facility, unless I have a cardiac facility. So I'll take them to the appropriate facility and just make sure I'm reassessing the vitals and my patient condition every 5 minutes and reassessing my interventions.
Okay. Anything else you'd like to add?
No.
All right.